Good afternoon, Tyndale. My name is Dr. Todd Cunningham, and I am a school and clinical child psychologist and a professor at the University of Toronto. And I want to thank you for having me back again to talk about the importance of mental health. I'm really sorry that I can't be there in person, but I'm glad that we have the technology these days so that we still can be able to connect. And I also want to thank the students who sent along these 10 fantastic questions to be able to kind of lead this session. And so for over the next 15, 20 minutes or so, I'm going to kind of just answer the questions that you have sent. So let me get into it. Question number 1. I have a friend that is afraid of the stigma of seeing a therapist or counselor. What advice would you give? Well, the first thing you have to understand is when you see someone such as myself, a psychologist or a psychotherapist or social worker, that we are bound by an oath of confidentiality. As a psychologist, I cannot reveal any information about a client that I see without their direct permission. The only time I can't keep something confidential is if I hear that they're going to hurt themselves or hurt someone else, or if as a child that they were abused by an adult, or if they are living in a long-term care home, they are abused by an attendee there, or if the courts ever ask for my records. All very rare situations. But beyond that, I can't reveal anything. The sessions are confidential. And so making sure that individuals know that is really, really important, because when you're meeting with someone, you might not want them to be talking about what you share with them, which is fine. The other thing that we have to think about is how do we get there? You know, if you're in the college or residence, how do you get to the counseling wing? And then if I run into someone along the way, what do I say? And as a friend, I could practice those things with my other friend who is seeking treatment, to be able to talk about what some of those strategies might be on the way over if we ran into someone. But a bigger thing to kind of get into is just talking about the motivations of why they're feeling that they can't talk to an individual, and just listening to them and hearing them out is really important. And as a friend, you can always volunteer to go with them. You might not be able to be in the session with them, but definitely volunteer to go with them. And after the situation, make sure that the two of you go for ice cream or something. Do something nice. The second question is, what should I do when my friend who has anxiety says that they need space, but I can tell there is something wrong? How can I approach them to check in and make sure that they are doing all right? Well, the first thing is to check with yourself about why are you feeling anxious about your friend and the need to check in. Are you feeling anxious because you're just not sure what's going on? Or are you feeling anxious because you actually feel that your friend is actually possibly a threat to themselves, that they could do physical harm to themselves, such as suicide? And if that's the case, then it's important to be able to get professionals involved immediately. However, if you're not really sure why you're feeling anxious about it, then maybe you don't need to actually talk about their anxiety. Maybe it's better to invite them out for a cup of coffee, or go for a walk, or do something that the two of you enjoy together without bringing up the mental health issues or bringing up the anxiety or stressors that person has. There's a lot to say from being a friend of just being present and doing nice things together. That actually can create a very positive environment, a positive interaction that happens that can lead to a kind of an upward spiral in emotions. By having a good time with someone else, by having a positive event, makes a person feel a little bit better, which actually might reduce their anxiety symptoms and allow them to be able to engage better. So just creating good positive times where you're not actually talking about the issues at hand, but just enjoying each other's company can be a fantastic thing to do. Question 3. Sometimes when I'm really depressed, I stay in my room for weeks. I miss classes and assignments, and that causes more stress. What do I do? At the clinics, this is unfortunately a common one we get and we hear. You know, I'm feeling down. I don't feel like going to class, but suddenly I've missed 2, 3, 4 weeks, and now the workload is even more, is so great. I'm feeling even more overwhelmed, which just adds to my depression and makes it harder for me to be able to engage. The first important thing is to, when you're recognizing this, recognize that it's important to reach out to someone, either to a friend or reach out to a professional to help just develop a plan. That's a really important thing. We need a plan. We need a plan to be able to deal with the work so the work is not totally overwhelming to you. We can break these things down into smaller pieces. And if you work with a therapist or someone at the college university, then they can also probably help support you in talking with professors to be able to get extensions or to be able to develop plans to be able to make the work much more manageable. Within our institutes, there are plans in place to be able to address when mental health does interfere, to be able to get students back on track. The other thing is, even before you make that plan with someone, you might just need to get out of your room, go for a walk. And sometimes that's easier said than done, but it is amazing once you get out of the environment that you're in, that you're feeling depressed within. There's something about kind of the downward spiral of emotions when we're in a place that we're feeling kind of trapped, contained, that we're feeling bad in this environment. Just being in that environment can continue to amplify those negative emotions that we're having. By getting out, going for a walk, having some time in the sun, getting some fresh air can do a lot to our just general state of how we are feeling. And usually that's a good time then to make that next step of contacting that person who's going to help you with developing that plan. Take that next step there before you go back to your room to be able to help out, or contact your friends and just let them know, hey, can you come with me or help me contact someone where we can be able to put that plan together. And once that plan's together, then continue to check in with the person you've developed that plan with, that therapist, that counselor, that support person, so that you can continue to update them. Because no plan is perfect right from the beginning. We often have to update it based on kind of what's going on. Question number 4. How can I say no to helping out a family member with their mental illness when I am already burned out? Excellent question. Compassion fatigue is very real. That's when we are looking after people, looking after a loved one, a family member, a friend for a prolonged period of time, or even more than just a friend. It could be even being involved in frontline work in the area of physical and mental health. But it's when we are working for a prolonged period of time and our own resources begin to decrease. And there's a guilt that we often feel as care providers about taking a break to look after ourselves, a guilt that we are giving up or abandoning the person that we're looking out for, a worry that if we are not present, that something bad is going to happen with that person. However, as the sign on airplanes indicates, that if there's a loss of cabin pressure and the signs and the airbags are to fall down, it's important to put the one on you first. Look after yourself first before you look after a dependent and help that person, that child or other person beside you. We have to look after ourselves. We are no good to anyone if we ourselves are not functional and able to work. And sometimes what that is not maybe saying directly no to the person, but increasing the people who are in the circle of care to be able to provide for that individual. calling on a friend, a family member, maybe taking them and getting them connected with a profession, to be able to help out. Or sometimes it is just building into our routine on a daily, weekly basis where we're taking an hour, 2 hours for ourselves to be able to do something positive. Go out for that walk, do something that we enjoy. Talk to someone about how we are feeling, to be able to do that self-care. Make sure that we're getting adequate amount of sleep and rest. Those are all really important things to be doing as well in terms of the self-care that needs to go on. Number 5, I get twitchy and lightheaded a bit before tests. How do I know if I have anxiety or just normal levels of stress? Well, the first thing that's important to understand is stress is a measure of how much arousal we have going, or how much load there is on our bodies, how much energy our bodies are currently using. So having some stress is really good. If you have no stress, then you're actually dead. So having some stress is good. And actually there's an optimal level of stress that you need to have before you actually hit kind of that critical peak of performance. Just being prepared for today, in talking to you, read over your questions, made lots of notes, kind of got myself going, hit the record button 3 times before I felt actually comfortable to start talking to you. So I needed to get to a certain level of stress to be able to have a good performance ready to go. However, when that stress goes too high, then it can become problematic. Now, in this case, the person's feeling twitchy and lightheaded. Well, part of that I would also want to know is, well, how much coffee have you had just before the exam? Sometimes we're downing a lot of coffee or caffeine stimulants before we get going, which can lead to feeling lightheaded or really twitchy. Did you just pull an all-nighter the night before and didn't get any sleep, and now you're kind of starting to feel fatigue, and so your stress level is very high because your body is trying to keep pushing you through to keep you alert and ready to go? That can also lead to you feeling twitchy and fatigued. So there's more to this question. First, we have to understand kind of what we call the antecedents. What else has happened before that test happened that might also explain why you're doing it? And often sleep, too much stimulants, caffeine or other stimulants out there, not enough food, not having a proper meal, not drinking enough. Those are other really big things that can lead to you feeling that way. However, if those are kind of okay, then we're into kind of feeling a sense of what might be considered more tested anxiety. So the next thing to look at is this now impairing me? Am I unable to perform in the test? Am I getting to the test, reading the first question going, oh my goodness, I don't know what the answer is? Or having that kind of tip of the tongue phenomenon, like I know it, but I just can't get it out. When those cases, then yeah, that stress level has kind of peaked higher, gone up high enough where it is now impacting with your performance. There is impairment that's beginning to come out. And if those are the cases, then definitely you can talk to someone about getting some good strategies. And a lot of those good strategies are about just kind of preparation, mentally preparation for the test. Telling yourself, hey, I've gone over this work. I kind of know what this work is. Doing some good deep breathing or box breathing where you kind of count in for 10, hold for 10, and let out for 10, and really kind of watch your breath and pay attention to the sensations that are going on within your body. These things help a lot with being able to just to calm yourself down so that you're ready to engage again in the activity that you're being presented with. So think about what might also be causing you to feel a little anxious, but if that anxious is actually impairing you and you're not finding you're able to work, then doing something to help calm yourself, monitor your thoughts, see what kind of negative thoughts or doubtful thoughts that you have there, and try and put those aside so that you can focus back on the questions at hand. And if this is becoming chronic, then definitely go and see someone one of the therapists or counselors at the university to be able to get some additional strategies to help you with this. Test anxiety is a very manageable thing. Question number 6. I'm graduating this semester and I had a diagnosis of moderate depression. I've always felt comfortable speaking with my professors about it. And how do I bring up my diagnosis to future employers? Disclosure in the workplace is a very challenging thing. And unfortunately, there's not one great answer. It is a little bit environment by environment. Unfortunately, though we have good laws in Canada and Ontario to be able to prevent from being discriminated when we have mental, if someone has a mental disorder, though there are still biases that exist against individuals. Typically, when we're talking with individuals, we say, don't disclose on your job application. Don't disclose in the interview. However, it's best to start talking with your employee after you get the job. It's best in starting to talk to your employee about what things you need to have in place to optimize your workplace performance. Employers like their employees to be optimized and really to give their best. And so it's important to talk about things that what types of accommodations you will need to be able to do that. Maybe you need to start at 10 o'clock or 11 o'clock in the morning and work later into the afternoon on a daily basis because you have a hard time falling asleep at night. And you find that you kind of sleep in more and your more optimal time is kind of mid-afternoon for your performance. Maybe you need to take more stretch breaks throughout the day so that you can just get out and move and come back. But talk about the strategies that you've used in the past to be able to help you to be able to stay on task with your academics, and take those same strategies and proposals as things that will help you be your best within the workplace that you're in. The other good thing is to find a buddy within the workplace in where you work, someone that you can rely on to help out and kind of, again, talk about what strategies work best for you to be able to be at your optimal. The thing that you don't want is to be constantly talking about your mental health issues. You bring them up when it's appropriate to bring them up. Bring them up if you're really feeling that you are not performing at your optimal, that you really do need more levels of support to be able to work. And bring it up if you feel that this is a safe environment in which you're able to do so. The time that it's hard to bring it up is after there's been repeated failures, though. If your mental health issues are leading to you to fail over and over again, if you are chronically late in for work, if you've had poor performance reviews, then bringing up the mental health issues can be a more challenging time. It is always best to put in place supports before issues arise, then try and use it as an explanation for why issues have occurred. You still can do that, but often it is easier to do it proactively than reactively. And that's the same at university and college as well. Usually it's better to get the accommodations in place prior to issues arising. Question number 7, are there any things I can do to bolster my mental health? Yeah, there's lots of things to do to be able to have a very balanced work life as well as being mental health. Getting good sleep on a consistent basis and having good, what we call sleep hygiene, is great. Going to bed at the same time, waking up at the same time, getting that 7-8 hours a night, fantastic to be able to do it. Eating well, fantastic. Having that balanced meal based on the Canadian Food Guide is a fantastic thing. Exercise, amazing. Getting out and getting your heart rate up for 30, 45 minutes a day, a wonderful thing to be able to do it. Find time to pray and meditate, a time to really let yourself relax, your brain kind of relax on a daily basis, is a wonderful thing to be able to help out. There's been fantastic studies that just show the power of meditation in terms of being able to quiet your mind, to notice when intrusive thoughts are coming in, and kind of to be able to recognize those thoughts and be able to put them to the side is a fantastic thing that you're able to do. And then just find time to socialize and enjoy the company of others is also a very important thing for us. Great question. 8, some of my friends tell me my anxiety is a lack of faith. I trust to help me, but it gets frustrating when I don't feel better. Is it a lack of faith? Well, anxiety is a very biological thing. As I said earlier, we all have stress because we're alive. And so stress is just how much energy we're using at any given time. Based on the environment that we're in and based on the thoughts and pressures that we're feeling, our stress vary on a moment-to-moment basis. And if our stress levels get too high for too long, then what happens is there's a part of our brain that is designed to be able to protect the organism. It's built into our neurology. And what happens if the stress stays too high for too long, then we go into what's known as the fight or flight response, which is kind of where anxiety symptoms come. Is the brain reprioritizing how the body is using its energy to either try and escape from the environment that's making you feel anxious or feel highly stressed, or to attack the thing that's making you feel stressed. Unfortunately, in our day and age, when we have lots of competing stressors coming along from us, we are often getting into this area for too long, where we're having anxiety symptoms on a very regular basis, or it can be even a chronic basis, leading to us feeling impaired. And so therefore, not doing anything about it is problematic. And so therefore, talking to someone, getting professional help, looking at your sleep, your eating, going out for exercising, meditating to yourself with God, all these things are fantastic things to be able to do it, but it's not a lack of faith. It is an indication that there's a lot that's going on with you right now. And it's probably time to look for changing some of your own behaviors to be able to engage in a way of helping to deal with the feelings of anxiety, dealing with the things that are in your life that are causing you to feel anxious. And it's great to be able to talk to a therapist or clinician about those, so that you can help to identify those and develop strategies and learn techniques to be able to help yourself feel better. Question 8, somebody in my family has a mental illness. What are the chances that I will go through that as well? Well, though there is a biological component to mental health, so there's a hereditary component to it. So people who have mental health often have a relative who has also had similar types of mental health issues. What it does is just increases the likelihood, but it does not determine that you will have it. There's a lot of things that you can do in terms of the environment and your lifestyle that can help you reduce the risks of having mental health. So we talk about risk factors. So having a family history of mental health increase the risk factors that you'll have it. But you can increase then your protective factors around those risk factors. A lot of the things we talked about in terms of boosting your mental health are the same things. Good sleep. eating well, exercising, meditating, having positive social interactions. But the other things you might need to do is be able to see a therapist or a psychologist or psychiatrist if there's a higher risk for you to develop those, so that you can again learn more about things that you can do to prevent the onset of mental health issues. So it's not completely deterministic. Just because my parents had it or someone who's related to me has it does not determine that I am definitely going to have it. We have to look at the risk and preventive factors there, protective factors there. And what we want to do is kind of load you up higher in those protective factors to prevent those onsets. And the last question, number 10, is how do I tell somebody that my friend is really depressed or struggling without making them hate me for betraying their trust? Well, I guess the first question I would have is, why do you feel the need to tell someone else about some information that someone has shared with you in confidence? You do want to keep someone else's trust. So I guess thinking through this, I guess, the way that I kind of think about it is person A has depression, person B is their friend. And my guess is kind of in the scenario, person C is feeling offended by person A or is feeling angry at person A for the way that they are behaving. And they've kind of come to person B, and person B is trying to help person C understand why person B is the way they are. So without, violating the trust by telling them kind of confidential information, I think it's very easy just to say, well, maybe there's something else going on in their lives right now. Maybe something has, maybe they have a lot on their plate right now. I would help them just to try and think through the behaviors a bit more, maybe not to personalize the behaviors that much that person A might be showing to person C. But I wouldn't violate the trust. I would more talk it through with them and just kind of saying, well, why are you feeling so so defensive or so angry about this? Maybe there's another explanation for why they behaved the way that they did. I propose the questions. I talk it through a bit with them first. I wouldn't violate the trust that you have with the individual. The only time that we need to talk and violate what we know, it's not in violation, but it is the purpose of keeping people safe. If we do know that someone is a threat to themselves or others, then it is our duty as citizens, as friends, as humans, to be able to protect each other. And so that's a time to be able to go and talk to a professional about that. Well, I want to thank you for sharing a piece of your afternoon with me. These were 10 excellent questions. And so I thank those who helped pull those together. And I wish everyone the best. I also want to say that these ideas I give you are ideas and things that it's always good to be talking as a community about. This should also, in what I've talked about, should not replace talking to a professional. There are a lot of variabilities in each of our own lives and each of the journeys that we are on. And so it's always important, if we are feeling stressed, that we or we're feeling we can't cope, that we always do talk to a professional about those. What I presented here today are some of my ideas to the questions that you proposed to kind of help continue on the conversation around mental health at Tyndale. And, but again, if you're feeling that you yourself are struggling, then I do encourage you to go and seek out support.